Yeah.
Laura and I are never short for words, so
No.
who's going to talk first?
Yeah.
Well, thank you so much. I'm so glad to be back here this year. And I was so excited to be able to do this with Laura. Laura and I have worked together for, like 6 or 7 years.
Yeah.
At USA Today, when she was at USA Today and the Louisville Courier-Journal. And so I'm excited to be able to do this because I really miss her now that she's at Kaiser Health News. But we did do one story together. But we share a love of the stories behind the stories, and we both feel so strongly about it. And I'd be the first one to acknowledge that she's better than me at it, very good at this, being able to tell people's stories, because it's really challenging in our medium. So we're going to give you some great advice on how to do that and tell some stories about how we've told our stories.
Yeah, and I would also say that patient safety has been really something that we've both been very interested in and have written a lot about. Yes. And so we're going to give you a couple of examples of stories that kind of touch on that issue, and then hopefully give you some ways to kind of connect with reporters to tell these important stories that need to be told. So this maternal health and safety story, basically it was a 3-part series, and we looked at how and why the United States has the highest maternal mortality rate in the developed world. And we had a lot of findings, but a couple of the major ones. Basically, hospitals know how to protect mothers. They just aren't doing it. So about half of maternal deaths can be prevented or reduced with better medical care. So sometimes people think that the reason the U.S. has such a high maternal mortality rate is issues surrounding people not getting prenatal care, and those are serious issues that do contribute to this. But what also contributes to this, we found, was what's happening in the hospital. So we found that with some of the biggest killers of women during and around childbirth, preeclampsia, hemorrhage, and infection. A lot of these things, there are ways to prevent and reduce these problems, but they're not necessarily being done, even though out in the literature, the medical community knows that there are ways to reduce these problems, but they're just not all doing it. So the result is every year, about 700 women die around the time of childbirth, and 50,000 are severely harmed or injured, which is just really unacceptable. And then another big issue is states have a part in this as well. So some of you may know there are things called maternal death review committees. There's also infant death review committees and other sorts of committees like this. Basically, all of the maternal death review committees and their reports for recent years was that some of them did not focus at all on some of these issues that I just talked about, like treatment in the hospital of preeclampsia, hemorrhage, infection. They have really focused almost exclusively, in some cases exclusively, on lifestyle choices, larger societal problems like poverty rates, which again, of course, the social determinants of health do play a big part, but you can't tell the story of why we have such a problem in the United States without talking about what's happening in hospitals. Because poverty, not getting prenatal care, et cetera, that's happening in all of these other countries as well. So it's not the whole answer. And when states look at this, a lot of times they act like it is the whole answer. And some states don't look at maternal deaths at all. So that's another issue, obviously. And so this is one of the stories, and this is what I was just talking about with states. So we brought national attention to this, and because I'm based in Kentucky, or was based in Kentucky, I'm now based in St. Louis, but I was based in Kentucky. I did include this Kentucky family. They lived in Kentucky when this woman died of a severe infection that was not caught in time.
And how many examples, how many real people, because this was a, 2 or 3-part series, I forget. Three. So how many real people did you have? Because I think it's important also to talk about how we've gotten it down to a science on how people are literally reading our stories, and it's all, we can have this special filter on our stories, and we see how far they read, where they stop, and then leave the story. And so often, in one particular story, I remember they jumped down and wanted to know more about this young person, and I didn't say nearly enough about this young person, and I lost them.
Yeah, I mean, for the entire series, I mean, we talked to just dozens and dozens of women and the men who lost their wives, and family members. And in fact, we did a series of videos, which I'm going to get to in a future slide here, but we did a bank of videos basically with all these women telling their stories, and it was called I Am One of the 50,000. And so that in itself was a real demonstration to people that these are like real people's lives. This is the impact of this type of thing in real people's lives. And yes, I would agree that that's what people want to see. That's what they want to read. I mean, sometimes I think of it as kind of taking your medicine, like the stuff that's not real people is almost like the medicine, and then the real people is like what the storytelling. When people are reading a news story, a lot of times that's what they're gravitating towards. So that really helps tell the larger story you want to tell.
And I used to think that it was kind of like my personal thing, like just I was one of the few people that did this, but Laura and I had dinner once with the former editor of USA Today and then our former editor, and the four of us all said, we will read these like 2 inside pages of the Washington Post, those stories that are that long, because we want it, and we often will jump ahead to learn more about the person. So like figuring out ways to tell whatever your story is through people is just so important.
It really is.
Because it's like poverty, you could say, oh, well, that makes sense, that there's poverty, so maybe it isn't so important that they killed these people. Not that we would think that in this room, but when you see the faces, it's just so heartbreaking.
Exactly. And I mean, you can tell by this picture, you're not reading the story, but I mean, it just says a lot right there to look at that face. And then, as we talked about before, impact. So this project actually helped get a bill passed in Congress, and it was signed into law, and it's basically to reduce maternal deaths. And one of the major tenets of this law was to get more states to do more comprehensive maternal death reviews, which was exactly on point with the story that I was writing. So that was a really great thing to come out of this, and I was really happy about it.
Maybe someday they'll review all the other deaths other than just, I guess, baby steps.
Yes. So this is the link for our I Am One of the 50,000, and if you wanted to go there, it's still up. And it's a really powerful bank of videos. And one thing I should say, I worked with several other people on this project, especially 2 particular other reporters. But I did most of these videos as far as interviewing these women. And one theme that came up over and over again with probably 3/4 of the women was some sense of the doctors didn't listen to me, the nurses didn't listen to me. I mean, it was just so much of a theme that I went to my editor at one point. I'm like, maybe we should write a separate story about listening to women, because it just kept coming up, whether it was infection or preeclampsia or whatever the actual subject of the woman's story was. At some point or another, a doctor or a nurse did not listen to what she was saying. If she was saying, it felt a little wrong, and the doctor dismissed it. So that, I think, is another lesson that comes out for me, that medical professionals really need to listen to patients.
Mm-hmm. And women in particular have that problem. Didn't the Atlantic, I think, did a big project, a story on that, and then African-American women in particular.
Yes, and I should point out, African-American women have twice the rate of maternal deaths in the United States than white women. So that's also a huge problem as well. And then, so in order to do stories like this, we depend on you, basically. I mean, we depend on the medical world, as well as just patients out there who've had experiences, because the more folks we hear from, the more we know what's going on. So some tips that I have is basically look for reporters who are already writing about an issue that you care about. So the discussion earlier on diabetes. I mean, we have Kaiser Health News, which, if you don't know what it is, it's a national news service that partners with media such as NPR, CNN, Washington Post, USA Today, etc. And we at Kaiser Health News have written about the caravans to Canada and some of the other issues around cost of insulin. So the reporters at our news service who have written about that before would be a good people to reach out to for that story if you wanted to get more, instead of just sending press releases to everyone, target. Also, contact, if you don't know, and probably most of you do, but contact information for reporters usually in the story, usually beneath it, and we like you to reach out. So, again, we depend on you. And also social media, especially Twitter. I mean, people reach out to me on Twitter all the time, and that's super helpful. And I do get back to people, and I read everything. And then, like Jayne was saying, the most impactful stories by far are those that include patients willing to share their experiences publicly. And I know that's scary. And what I think makes patients tell me stories, when I want them to go public with a really sensitive story, usually the motivation is to help others. And if someone is kind of scared about it, I might say, speaking about this really might help others. And that will usually push someone to do it.
And it also helps people get over their grief, I think,
yes.
to try to prevent something happening to another child. I've written a lot about things that kill children, and seems to be the only thing that kind of keeps people moving forward is acting so it doesn't happen again.
Exactly. And like these women who told their stories, that's uniformly what they told me. I wanted to help other moms. I never wanted another mom to go through this, so I'm using my pain to help others.
And I wanted to mention as well something that comes up for me now. Laura, I believe, got her start at the Hartford Current,
yeah.
right? Mm-hmm. We're both from Connecticut. And a lot of times people will start with someone at USA Today or the New York Times. But some of the people that I covered auto safety for like 25 years. So like the people that were my best sources towards the end of my career at USA Today covering that were the ones that reached out to me when I was a younger reporter. Because a young reporter could really use the help. And, some of these stories like today, a diabetes story, if you help find someone, a young local reporter, a local example of a national problem and give them some of the context, you're doing them a favor as well as yourself. And, you're helping someone out young who's going to stay with you. I often used to joke that some of the car company people that didn't pay any attention to me until I was at USA Today, I ignored them. They didn't give me the time of day when I was younger. I also find it's really helpful, and this is something that my husband used to tell me years ago. He had some friends that were, had gone from journalism to PR, and these hospitals would think, that the Wall Street Journal should do one of those A-heads, they call it, one of these front page stories about their hospital. And they would have to say, no, you have to understand that you may just be a mention in a larger story. And unfortunately, as Laura and I were talking earlier, you have to recognize that even though I bet everyone in this room has a story that's worthy of either one of us publishing, the chance of either one of us getting the time, even she's with a nonprofit now, getting the time to write your individual story is very small. So be prepared to be an expert on other stories. So to have your little soundbite ready when sepsis or when diabetes or when insulin or something is in the news, you could be helping the reporter by calling, especially when you see it just happening. When something is being announced, there's a lot of times people wait till the story comes out and then email you the next day in case you're doing anything. Like I said, reporting to new developments. And another thing, I'm not good at this personally, but I think we ought to try it in a few minutes after we're done with our presentation, to be able to tell your story very concisely. I spent a fair amount of time with Melissa last year, and it was such a powerful story, what she and her family have been through. But this is no criticism of Melissa, it's just that I have so many stories in my head. I'm working on a project on family court and child custody issues around domestic violence, something Rachel Bremmert and I share an interest in. And then I'm writing about vaping all the time. So I have to be reminded, because I want to talk to Melissa again about candor, because I'm very interested in that story. Like, what are the 3 key things your story is an example of? And she may well have told me, and I just forgot that they've all blended together. But I thought that's a great story I should do. I should remember it when I write about sepsis or when I write about disruptive doctors or one of the other kinds of problems. So I would really suggest that you be able to say the old elevator pitch. My story is an example of what happens when the insurance companies are in charge, or a hospital gets bought out, or the testing is inadequate. And then the 2 or 3 most important details, and frankly, most sensational details, the ones that would have to be what any journalist would put in a story. We'll have to admit, the first thing that popped in my head when I thought of that is in my family court child custody story, there's a man who has gotten custody away from the mother so the kids can't see the kids, and he's supposedly a public nudist. I mean, you just have to get that in a story. Like, it's just a detail that's just crying out for, like, this is how crazy this system has gotten. And he's abusive, more importantly. But those kind of little details that just make people go, oh, I can't believe it. They did that to a 6-year-old or something like that. Don't call reporters. Would you like to be called?
It depends. I mean, I think if you are someone with, I'm writing about a particular thing and you have a great story on it, then yes, I would like to be called, but not just.
Yeah, I like to be
pitching.
emailed first, partly because I talk too much. So when they call me, then I've lost track, and I go, there goes a half an hour. But I generally think email is a good idea, just so so I'm ready and to talk at that moment. But it's a good idea to ask.
Email or Twitter?
Well, I don't care for the Twitter because, I mean, you can message me on Twitter if you can't find my email address.
That's what I mean.
Yeah. Oh, I thought you meant like tweeting at. No, I mean, I'm okay with that. I find a lot of people, I sometimes message people on Facebook and they just aren't the people, even our social media, head of emerging social media. I guess it's not emerging enough. She didn't even see my Facebook message because she's, moved on to TikTok or whatever the heck she's doing. So don't assume that people know to check that. But yeah, it's pretty easy to find reporters' emails these days. I put it out as much as I can. It's in my Twitter bio, I think, and my Facebook bio. And really, it's important to kind of target it and like not fake that you're targeting it and just put a different name at the top, because we really do like to feel we're special, even if we're not with a really big publication. I wanted to use this example. I think when I was here last year, I was talking about the sewage at this hospital, but getting back to the example of how many problems this family, I've come back to them on sepsis. They could be an example of confidential settlements in a positive way. They almost went to court. There was a lot out there, and he was talking. So I have that body of information. He has humanized that story so much, and it's so hard with infection stories to find people who you can even conclusively say, and of course we can't even conclusively say that this guy, his wife died because there was sewage all over the floor, but the hospital wasn't going to take any chances that he was going to be going around saying it. He thought it was. So they made a big settlement, and I know the stories are what prompted them to do that, or offered a big settlement, and he took it. And I think of them all the time, in part, my brother, I was telling David Antu, which is getting me more worried, because my brother has to have prostate cancer surgery next month. And, he's going to go to a hospital with a C rating over this A-rated hospital. And I'm like trying to talk him into that. And I'm like, think of these people all the time. They had 2 daughters who were doctors, and they researched the surgeon, but they didn't research the hospital's ratings. And I know ratings can be different. They might not be true in every case and all of that, but there's certain basic things. And so that family has become an example of so many things. And I will go back to him. He won't be able to talk about the specifics of that case, but I'll probably go back to them time and time again. This was one of the women that, speaking of David had alerted me to the allegations of rape at Cleveland Clinic by one of their former surgeons. And because of this woman and the relationship I developed with her when I was doing the original story about this that did lead to him losing his job, although not his medical license. Maybe you need to have 3 cases of anal rape to lose your license, I'm not sure. She told me that she was going to be speaking at the Federation of State Medical Boards. I covered too many different things. I would have never known that the Federation of State Medical Boards was looking at the funny-ish named boundary issues. So this woman who says she was anally raped was testifying about how boundary issues are important. And I met another woman through her. So keep in mind, we all have hard jobs, but we really want you and you really want us. So it really helps to work together on this kind of thing.
And can I interrupt for a
Sure.
second? So with the maternal mortality stories, I also did some Kentucky-focused stories because I shared my time between USA Today and the Courier-Journal during that job. And there was a woman who I did a story on for the Courier-Journal who ended up being an amazing source who connected me with a lot of other women who had been affected by nearly dying during childbirth. And having that relationship, and she still keeps in touch with me even at my new job and says, hey, we're looking to have a bill, and she's kind of following the various things going on in both Kentucky and at the national level on this issue. And so it's really helpful for me to know what's going on because she keeps up with it.
Yeah. I will never be able to keep up with these individual issues like you can. And even vaping, I was holed up for a while there. I'm having to write about something to do, the metal poisoning you can get from the soldering in a vape device. Like if there's a new development in that, hope I don't know about it after I'm done with this story. But if there is a big study, it'll be helpful when somebody tells me about it.